We also are right down the block on Evans Street. If you go all the way down 10th, make a right hand on Evans Street, second driveway on your left. We're right here, we're local, we've been here for a long time. You can stop in and see me. I've got my phone number, address, email, any way you would like to contact me. I want you to feel free to do that. What we're going to talk about tonight is a new and exciting approach to chiropractic care. I've been a chiropractor now for 15 years, getting long in the tooth. Over the course of the past year, I've come across some of the most exciting information that I've ever seen in my life. I met up with this wonderful, brilliant chiropractor. He's a chiropractic neurologist from Wisconsin. And he's been kind enough to share this information with me that he's been using. We started incorporating some of these strategies, and the results that we're getting are completely phenomenal. So if we just follow along with these slides here, you can see it's an introduction to neurological-based therapy or brain-based therapy. That's what we call what we're doing in the office. When a patient comes into our office, we're evaluating the status of their nervous system. One, we want to find out if this person is a candidate for brain-based care. And two, we want to find out what part of the brain we need to be focusing our care on. And when we can decipher which parts of the brain are not functioning properly, then we can really pinpoint exactly what types of therapies we need to do, what kind of things we need to do to get your brain functioning properly. And we've been able to do this with a whole lot of success over the past few months. It's just blowing me away, the response that we're getting from some of these patients that have been suffering with chronic conditions for years. Patients that have been to a half a dozen, 9, 10 different doctors. Patients that have gone from this medicine to that medicine to this medicine. Patients that are now taking other medicines to cover up the side effects of the first medicine. This is why I get out of bed in the morning. Because there's people, and there's probably a bunch of you here, who are taking medicines and you still feel the same. This is ludicrous. Now, I'm not here to bash medicine, medical doctors. It's not going to happen. Some of my best friends are medical doctors. And medicine is miraculous. Some of the modern advances that we have with medicine is miraculous. Acute care crises, medicine. This hospital is the finest. The shortcoming is chronic conditions. Modern medicine doesn't deal very well with chronic conditions. Try this pill, come back in 2 months. No, it's not working? All right, try this pill, come back in 2 months. That's not an answer. Has anyone ever heard these things before? Take this pill and come back in 2 months. This is why I get up in the morning. This is why I do what I do. There's another alternative. There's another way of approaching these things rather than just poisoning your body with different kinds of toxic substances. That's where we come in. The drug-free solution. We don't do drugs in our office. I don't prescribe them, and if I could, I wouldn't. Some of the conditions that we're seeing, and you saw the ad in the paper, some of the ones that we see a whole lot of over the past few months, fibromyalgia. I guarantee everybody here in this room knows what fibromyalgia is. They've heard of it. They know somebody who has it. If you don't have it yourself,
What is it?
well, we'll go over those individually later. But fibromyalgia is generally, you're hurting all over the place, and your medical doctor can't figure out what's wrong, so he says, you got fibromyalgia. Take this pill. Take amitriptyline. Go out and get some exercise. I can't exercise. I feel crummy. That's what they tell you to do. Balance disorders. Dizziness. I know from when we took the phone calls when you all were calling in that that's something that people are suffering with. Vertigo, the room spinning around, dizziness. Take this meclizine. Go home. I'm taking meclizine, I'm still dizzy. What do I do now? I don't know. Right? Go to sleep. If you're sleeping, you're not dizzy. Take sleeping pills. It's cheaper than meclizine. Chronic fatigue, also associated with fibromyalgia. Chronic pain. Anyone? Chronic pain. Yeah. Hello? Headaches. Migraines. The list goes on and on and on. But these are some of the most common things that we're seeing where we're able to help people who have not responded to medications. People are about hopeless. The next slide, your nervous system. This is what chiropractic is based upon. Your nervous system is the master system of your body. Your brain and spinal cord control the function of every single cell in your body. And when there's proper communication between your brain and your body and your brain, things function properly. When that feedback loop is not functioning properly, we start to develop some type of symptoms. What medicine does is they'll throw a pill into your body to cover up your symptoms, but does not fix that neurological wiring in your body. That's what chiropractors do. Does that make sense? All the cells in your body rely on your brain and your nervous system all of the time. And that's the definition of health, according to the medical textbooks. Health is when all systems of your body function at 100% all the time. And they cannot be functioning at 100% all the time when your brain and your body aren't talking properly. Next slide. Your nervous system controls and coordinates all the systems of the body and relates the individual to their environment. Big fancy name for that is homeostasis. Remember that? Did anyone ever hear that word before? You don't know what's going on.